case is dual CTO with rotatripsy. Rotatripsy is rotablation, imaging, IVUS, HD, and for calcium modification, I have used intravascular lithotripsy. This is my case history. 55-year gentleman with history of gradually progressive angina for 5 years. He is a hypertensive smoker. CCS class 4 angina for last 3 months. ECG, ST depression in V2 to V6, lead 3, AVF, ST elevation in AVR. Echocardiography, normal LV function, no regional motion abnormality. So these are my hardwares in these cases. Filter FC, filter XTA, and ultimately I had to use the Gaia second, fine cross microcatheter, Nick Nano balloon, Sprinter Legend balloon, IVAS HD, Rota Pro, intravascular lithotripsy, and as usual, NC balloon for post-dilatation. So this is my coronary angiography. You can see the right coronary artery. It is CTO, chronic total occlusion, 100% occlusion for more than 3 months, at least. So this is a complete occlusion for more than 3 months. We can see a lot of collaterals. And this is the left system. You can see the left anterior descending artery total cutoff, which is also likely to be a CTO. The duration for more than 3 months, according to the symptoms of the patient. This is the wire crossing and wire exchange. Before telling about the wire crossing, the right side, it was a very difficult CTO, JCTO score of 3 at least. I have used the gradual escalation of the CTO wires. First, I have tried with filter FC. Then I have tried with filter XT. Then I had to use Gaia second. You can see in this, I am able to cross the lesion. After crossing the lesion, then I have to exchange the wire into the workhorse wire. And obviously, since it was a very critical lesion and RCA was 100% occluded, LED was 100% occluded, and LCX was 95% occluded. So I had to use this temporary pacemaker. So this is the IVAS run. You can see how fibrocalcific the lesion is. The arc of calcium is around 270 degrees. So that was the burden of the disease. In this, you can see after doing intravascular lithotripsy. In the intravascular lithotripsy, I'm sure many of you may be using. Intravascular lithotripsy is just like a normal balloon, just like a NC balloon, but it is fragmenting the calcium, breaking the calcium. So after doing this intravascular lithotripsy therapy, when you are dilating with the NC balloon, your calciums are much better responding to your dilatation. So this is the final results of my right coronary artery. You can see the TME3 flow, which was 100% highly calcified occluded vessel, now having TME3 flow. This is the LED. You can see after crossing the LED with a filter XT wire, what I did, I took an IVAS run. This is the IVAS run. LED was little bit less calcific than RCA, but again, it was fibrocalcific. So I decided to go for rotablation. You can see the rotablation in that screen. Rotablation of the left anterior descending artery. After rota, you can see little bit of improvement in the flow. However, it is not satisfactory yet. So after doing rota, after doing IVL, after stenting all the three vessels, RCA, LED, and the left circumflex, you can see now that the TME3 flow. You can see the almost normal left coronary flow in both the artery. You can see the LED slowly. So this is a post-rotatipsy IVAS run of the LED. So the LED, which was very tight, it was 100% occluded angiographically. Now I got an area of 9.44 millimeter, which is more than satisfactory. In the proximal LED, we usually say anything more than 7 is quite satisfactory. So I have got an area of 9.4. So coming to the conclusion, it is a cheap case, a complex, high-risk indicated procedures. These are difficult, but these are highly rewarding. Multi-vessel PCI is an attractive alternative to CABG. CABG options was given to the patient, but they have refused. They have requested to do PCI. So all the technology, when it combined with the proper planning, it makes CHIP easier. The future belongs to interventional cardiology, and people hardly prefers open heart surgery nowadays. And short-term results are definitely in favor of the CHIP. We need more study for longer duration, how they are responding to our treatment. Thank you.